I was giving a lecture on Shelter Island, which is at the very tip of Long Island, for those of you who do not know this area. And I was giving a talk and went to a lawn party after the talk. And I noticed that half the people on Shelter Island were marching around with crutches. So I went up to one of the ladies with crutches and I said, "What's going on?" And she says, "Oh, it's Ehrlichia. It's endemic on the island." And it was. And it's better known on islands at the tip like Shelter Island, Northport, the South Shore of a place like Shelter Island or Long Island, and of course in Rhode Island and in Connecticut, which borders the Long Island Sound. It can be found. It's also common in the Hamptons, which is a very, very big location for vacationers in the summertime. So you have to be aware of ehrlichiosis or anaplasmosis. The next disease, which is also very unusual sounding, is Babesia. Babesiosis is a malaria-like illness, very interesting, caused by a parasite called Babesia parasite, and it's also transmitted by the black-legged tick. Symptoms can vary from mild disease to very severe disease and include fever, chills, sweats, headache, body aches, nausea, fatigue, terrible symptoms that can go on for days. In severe cases, however, with Babesia, it can lead to hemolytic anemia. That means where the blood cells pop as a result of an immune reaction, and you can become very, very tired and very, very anemic. And organ failure can ensue, and that makes it extremely serious. Doctors make the diagnosis again through blood tests, and treatment typically involves a combination of antiparasitic drugs and antibiotic medications. Now, the New York Long Island shoreline, such as Fire Island, which is a popular destination for a lot of people, for example, primarily harbor Babesia in the summer. You got to tell your doctor about your summer locations when you go to see him or her. They're going to ask you, where were you this summer? Why would you have had a tick bite?